My topic today is supposed to be influence of the mare, and I'm going to look at this hopefully from the view of a practitioner. The talk's entitled Equine OPU, Clinical Considerations for the Practitioner. And of course, OPU, in the US, we typically call it TVA for transvaginal aspiration or follicular aspiration or something like that. In Europe, they call it OPU. And I just don't like the sound of the word OPU, so I'll call it OPU for us today. First of all, we'll talk about briefly, show you that what we're talking about today almost exclusively is the immature oocyte taken from small follicles, subordinate follicles. The dominant follicle oocyte, it can be useful clinically, but for all practical purposes, for efficiency, effectiveness, and results in practice, we want to stick primarily with the immature oocyte. So several years ago, I had a client bring a mare in from Texas, and he said, I've got this ICSI thing figured out. It's just all a numbers game. And I said, what do you mean? And so he kind of told me. He had it all figured out. If you took the number of follicles and your recovery rate and the maturation rate and blastocyst rate, put them all together in a formula, you knew what you were going to get. And there's some truth to that, but the truth to that is in a large population, the year's worth in a program or some large population. But in an individual case, this is not at all what you're going to get. You may do much better or much worse. Of course, we know that mares, if considered by their mare owner, just like the children in Lake Wobegon, all are above average. And so they expect results to be at least average, above average. Otherwise, put in this rate. And the heat factor is one of them, is the stallion factor that Dr. Ghali will get into. And most people understand that the stallions' results with certain semen sources will vary. But the mare is a little harder for them to understand. And unfortunately for that, it's one of our biggest issues. Okay, I'm going to use several numbers today from the program at Utrecht. They teamed up with Avantea, Dr. Ghali, and have a really good program there, and have a lot of results, and they're really good at building into the results to find useful information. And so I'm going to borrow some of their information for the talk today. One of their endeavors into figuring out information is they found that when they looked at a large group, took stallions that were used more than 4 times in a season, they varied considerably in results between stallions, between 4.4 and 30%. And I'm sure Dr. Ghali will get into this much better in his talk. So the average per OPU for these stallions was anywhere from 0.37 to 1.57 blastocysts per OPU. Mares, on the other hand, that were used more than 5 times varied anywhere from 0 to 44%. So in other words, one mare at least averaged 0 over 5 aspirations, or another one averaged 44.4% blastocysts per OPU, or yes, per aspiration, in a range of 0 to 3.29 blastocysts per OPU. So you can see the range is considerably larger with the mare factor, the identification of the individual mare. Also from that same study, they looked and found that if the mares that they called reliable producers, I call them golden, but reliable producers, if they got an embryo from the first OPU, had a 70% chance of recovering an embryo or producing an embryo in the next cycle. On the other hand, if there was no embryo on the first OPU, there was a 30% chance. So these were your less reliable mares just from that first instance. Now in practice, we try to tell clients what to expect. And of course, if you can meet or exceed client expectations, you'll have a happy client. So part of the issue is to help clients understand what to expect. So we tell them if they don't produce an embryo in the first 3 cycles, first 3 operation attempts, then there are potentially issues that with the mare that we might not be very successful with. So what is the mare factor? Of course, the first thing that everybody looks at is age. And of course, we started looking at age years ago. Dr. Carnevale, in a great study in '93 with an Inter, transferred oocytes from young mares and from old mares into open cuts and had a much higher, statistically significantly higher in young mares and old mares, which we kind of knew. Now, at the time, that actually excited me not to find out that that old mares had issues, but to find that you actually could get some pregnancies from these old mares. And of course, since then, she and others have shown that there's problems with spindle morphology and mitochondria and aneuploidy, et cetera, in these older mare oocytes. And we always hear that, oh, they were born with these oocytes. They're as old as the mare. But when we get into the ICSI situation, there is a slight decrease in the blastocyst rate per oocyte injected with older mares, but not nearly as great as one would expect. So age is not always our issue with these mares. The big issue with these older mares is the number of oocytes recovered because they have so many fewer follicles. Another issue with age is how old is old. And for us, what we see in our results is that 24 years is kind of a tipping point where you lose most of the effectiveness after that. So beyond life, if we recover, produce embryos. So what causes this variation between mares other than that? Of course, the first one we think of is the number of follicles. More follicles, you should get more oocytes. Of those follicles, how many oocytes are recoverable? Some mares will have sorry for the interruption. Some mares will have oocytes that are harder to recover than others. Consistently, you have a lower recovery rate with some mares. Some mares are consistently higher. You'll average 60+%, but there are some mares that are just tough to get embryos or oocytes from. Also, in addition to the difficult recovery, some mares will tend to have more expanded cumulus masses, and so those oocytes are easier to recover. And follicle size is the other issue. Of course, small follicles are easier to recover oocytes from than large because of the amount of turbulence, amount of scraping to recover an oocyte. Now, another issue that comes in once these oocytes are recovered is what I'm calling the functional age. It basically, this is a level of maturity. Oocytes start out coming in recruited from primordial follicles to antral follicles, developing a lumen, but these oocytes are very juvenile, very immature. And so it depends upon the phase in the growth of that follicle, how many times it's enlarged, been through a follicular surge, and then regressed to how mature that oocyte is. So we may be going in and recovering that oocyte when it's very juvenile, or we may come in after the fact when it's really past its prime and is atretic. So that the functional age of that group of oocytes from the mare will determine how many mature in maturation medium and are fertilizable later on. And then the big issue that is very hard to describe to clients is oocyte quality. And what we really mean, not because they'll expect you to be able to look at the oocytes and tell you what quality they are, but is their competence for further development. These oocytes in the small follicles, as we said, can be in varying stages of this functional age or maturity, if you want to call it that. And you can gauge that somewhat looking at the oocytes by the amount of lipids that are accumulated in the oocytes, and that's what makes the darkness. Early on in the juvenile oocytes, there's very few lipids. As they go to maturity and beyond, to atretically increase the amount of lipids. Cumulus expansion can give you some idea as well. Typically, one that has expanded cumulus is more mature than not. And these are oocytes that have been matured and are what we like to see. And basically a couple things. Of course, the polar body is extruded, which tells you it is resumed meiosis and it is in metaphase 2 and ready for us to fertilize, or somebody to fertilize. We have the dark areas and light areas. The dark areas are where there's an accumulation of lipids. You'll also see there's some perivitellin space. Typically, the very juvenile oocyte is a little bit larger, totally expands and fills the perivitellin space. The oocyte on the right has a little perivitellin space, so probably was at a younger stage in its journey through the ovary when it was recovered and matured. Both are beautiful oocytes, and based on their appearance, should work very well. So we've recovered this group of oocytes, and looking at them, you can tell a little bit about them. They all have very compact cumulus. You have some that obviously have some lipids, some that probably do not, but you really can't tell much about them. So no matter how ugly or beautiful, you're not going to sort through them to put into maturation. You just need to put them all into maturation to determine how well they're going to mature. The proof is in the pudding. So here are a couple of oocytes that were matured, attempted to mature from Mare. The oocyte on the left is a very juvenile oocyte. You would say it failed in our attempt to we failed in our attempt to mature it, not because of the maturation protocol was a problem, but because it was a very juvenile oocyte and not old enough in its journey through the ovary to respond. The oocyte on the right is got lipids, the clear area, and probably somewhere on the other side is a polar body. This, on the other hand, is an atretic oocyte. It was in the ovary too long before we recovered it. And while a little bit of atresia helps make the oocyte easier to activate, when they get to this stage and beyond, they're not useful for fertilization. Another thing, people expect us to look at the oocyte and determine quality through just looking at it. And shape is not one way we can do that. This is an oocyte that actually we injected this week. It is kind of eggplant shaped, and looking at the dimension that we can't see was very flattened as well. But we did go ahead and fertilize that. In fact, there's a sperm right there, and it's right in the incubator now, appearing to look pretty good. I think if you have a mare with a lot of malformed, mal-shaped oocytes, the tendency is for them not to do as well, but you can't discard them based on shape. Here's one that actually is a 5-day embryo from Pasofino, and it came in looking like a sausage. It's funny how they all compare them to foods, but the shapes. But here is actually a starting to compact morula, and then 7 days later, that's it. It was transferred, and later on, the mare had a foal that was not sausage shaped. Okay, oocyte competence is the ultimate determination for whether we have a useful oocyte quality. And the first thing we talk about is meiotic competence. In other words, the ability to mature, to resume meiosis once recovered from a follicle. And this, of course, is very much related to the functional age. Is it mature enough and not overly mature? This oocyte on the right is one that's been fertilized. The lipids, these are more evenly dispersed. You can see it's extruded some material. And here's actually a couple of pronuclei. This is probably about 18 hours after fertilization. So the functional age will determine the maturation rate largely. Then the next thing we talk about is developmental competence. Can it go from here, cleave, form a morula, form a blastocyst, form a pregnancy, form a foal, that's a lot to do. We've taken this oocyte from a relatively quiescent state and upped its metabolism, upped its maturation rate, asked it to start making more nucleic acids, more proteins, more mitochondria, all the cellular organelles that are needed in new cells, kind of all at our command. So developmental competence, first thing is, will it cleave? And of course, the first thing that has to happen there is it has to be activated. While the sperm cell and the sperm factor in it are required for activation, some mares tend to have oocytes that are harder to activate than others, while some stallions are poor at activating. And of course, you hope you don't put those two together. But you will find that there are some mares, even though they mature, oocytes do not cleave as well. So here it is, it's cleaved, and then it has to continue making more and more cells, more and more nucleic acids, more and more mitochondria, proteins, RNA, etc. And if it's common to do that, hopefully we'll get these blastocysts. So, is ICSI a numbers game? Yes. But let's look at the factors that the mare controls largely. Follicle number, somewhat the recovery rate and the maturation rate. Definitely the blastocyst rate is the big one. There is some difference in pregnancy rates in blastocysts between mares and also in pregnancy loss rate. So pretty much our mare identity affects almost every spot in this equation. Actually, the guy that gave me this pseudo equation was lucky enough he got 5 embryos his first aspiration, and of course he had it all figured out. The second aspiration he had 0, and so there went the equation. Basically, in oocyte competence, that affects our results so significantly. Is it that these oocytes are defective, or the mares don't make as good oocytes, or is it that we have not have our maturation program suited to these oocytes? Is it more that our maturation program don't fit all mares' oocytes? That's very possible. Also, some mares probably don't make oocytes that are as good. That's just the way things work. Things are all in a bell curve. But hopefully, in years to come, we'll come up with better ways, whether it's cytokines or other things, that we can improve the oocyte competence as they mature for more mares. Another thing, say you have aspirated a mare, sent off oocytes to a lab, and are expecting embryos back for transfer. So you've got a plan on that and be prepared for it. We know that these embryos have a more limited window of transfer than in vivo embryos. If you flush a mare, we can transfer a 6-day to a 9-day or even 10-day embryo with little change in results. And that's not true with these ICSI embryos. But the first thing you have to look at is, when am I going to receive them? So you can plan with your recipients. And if you're shipping off oocytes overnight, going to a lab, they'll arrive the next day, put in maturation medium, 30 hours plus or minus later. So the next day, they'll be fertilized. So actually, 2 days after you ship them is day 0. And you expect most embryos to come out of the lab on day 7 or 8. So you're looking at day 9 and 10 for them to be ready for transfer. But this limited window, some of it is dependent on the embryo. ICSI morula historically don't transfer well. I'm not sure that that's really the fact, or the trouble is there are a lot of good-looking morula that don't mature into blastocysts in the incubator, and so it's hard to tell if what you're transferring would have done well if you'd waited or not. But the fact is, you don't know if they're going to become a blastocyst, so it's really foolish to start transferring early and using up recipients. And then the blastocysts are limited more in an in vivo situation by the zona pellucida. Of course, in vitro, the blastocysts produce a capsule. It doesn't happen in vivo until they reach the uterus. And the zona pellucida is tougher, basically due to culture conditions, and so it doesn't thin as easily. So what happens is these blastocysts will not try to hatch, or basically they'll try to enlarge and stretch the zona, but they'll start oozing out through the ICSI hole, and so you'll have enough. They'll basically herniate. Enough herniation can potentially lead to an identical twin, another blastocyst, although that's probably not the way these occur, but it's a concern. Recipient is the other thing. Of course, normally in vivo embryos, we have a wide range of synchrony, but in these in vitro embryos, the numbers we deal with, we don't have quite a degree of synchrony, a window of synchrony to use. And these are numbers from Utrecht as well. And of course, this is from a large group, I think 400 plus embryos that they transferred. And you see that on recipient day post-ovulation, they have much higher pregnancy rates using a day 3 and 4 mare as opposed to a 5 and 6. And really, you look at these embryos, these are equivalent in development to a day 6 in vivo embryo. So you really wouldn't expect that degree of smaller window of synchrony. But one thing that hasn't been brought up much is that all these embryos were frozen thawed embryos. And they'll take an embryo and put it in a client's recipient, so they have a specific recipient lined up. So they thaw the embryo, put it right in the recipient. We found over the years that we thaw the embryos if we put them in culture medium, which of course is inferior to the uterus, but it allows us to expand and start growing relatively quickly within hours. The ones that may take a day or even 2 days. And so my guess is that some of this later results and improvements is due to those embryos that were slow in recovering from the freeze thaw process. So if we look at our numbers, now these are not really fair to look at this because so many of ours were fresh. The vitrified thaws are a small portion, and you see the percentage is very similar to pregnancy percentages similar to theirs. But since we're taking them out of the incubator, putting them in a recipient that's synchronized based on the development of the embryo as it's recovering in the incubator, I don't think it's affected quite as severely. These numbers aren't divided up enough to tell for sure, but it shows you there's a much wider range of synchrony available, at least for fresh embryos. Again, the day 3 and 4 were superior, but not by that much. So if you've got an embryo coming back and all you've got is a day 7 mare, you've got a reasonable shot. The non-cyclics that we used were started, of course, on estradiol and then on progesterone. And most of these embryos were transferred about 3 days after progesterone started. I don't know how I'm doing on time. I guess, well, Juan, will you jump in if I'm going over time? It looks like I may be. I've covered most of the topic that I was told to. I've got a few other slides here if we want to continue, but I'm guessing on the availability of time, we probably should cut it short. This slide will make our last. People always want to know when's the right time to aspirate a mare. And of course, the first thing is when is the mare available and when are you available? And that's most important. Second, for your best recovery, you're going to want to aim at small follicles, typically around 10 millimeters or a little smaller. Anything up to 20 is fair game. Beyond that, you're wasting a lot of time and effort for a lower recovery rate. So you're going to want to avoid the big dominant follicles. This is a very nice ovary for aspiration. Most of these follicles are about 10 millimeters, give or take. There's a CL, so you don't have a big dominant follicle in the way. And so it should be a good ovary to aspirate. So you want to avoid the large dominance. For one, you're not going to recover much from there. If you don't deflate it, it's in your way. If you do, then the ovary is very mushy and sometimes hard to hang on to. You want to go between follicular waves whenever the follicles are the right size. Usually it's just after a follicular wave that gets the best opportunity. So we're going to get out of this program then. And here we are is the end.